We're seeing that we're in the seventh wave because of the numbers that we're confronted to, which are much greater than they were before. I mean, less than a month ago, it was something completely different.
Quebec is officially in its seventh wave of COVID-19, and while public health says it will be weaker than previous waves, with rising cases, they're urging individuals to remain vigilant to help reduce the spread of the virus, respect the 10-day isolation period if infected, and get a fourth dose for those 60 and up and those immunocompromised.
The evolution should curve down during the month of July, but there are uncertainties over that, and we will follow this situation very carefully.
No new restrictions are being imposed for now, and the mask mandate is not being brought back. Over 1,500 people are being treated for COVID in Quebec hospitals, up by 19% over 7 days, and 7,000 plus healthcare workers are out sick.
I don't like the situation in our health system this summer. Remember, weeks ago I said this is going to be a difficult summer. We're lacking personnel.
Health Minister Christian Dube taking part in a public health press conference for the first time since February, explaining it was important to speak directly to Quebecers, adding that those infected aren't following the 10-day isolation period, and he knows with summer here, many want to enjoy the weather and see people.
The entire world is fed up with COVID. Let's be sure of that. But I think we've said all along that we need to live with this COVID.
A lot of people interpreted the lifting of public health measures to mean, oh, COVID is gone, I don't have to worry anymore. No, you still have to worry. You still have to think about the consequences of your actions. If you're sick, stay home. If you don't want to get sick, get vaccinated. If you don't want to spread the virus to other people, wear a mask.
Public health reiterating that vaccines are the best tool. Only 55% of those eligible have gotten a third dose and 15% a fourth in Quebec.
We have a fairly low vaccination rate when it comes to third doses. I mean, there's no real way to paper over that. Our vaccination rate for third doses is low. It's the introduction of the new variants. It's the fact that there were no public health measures.
I think it's inevitable because people are starting to get together. What we hope is that it will be less of an impact.
Yeah, I don't think we're ever going to get rid of it. It's just like a disease that exists now, so it's going to be waves. There's probably going to be more waves as long as we know how to manage it better.
What has to happen now is, I hope, mitigate it as much as possible so you don't put even more stress on the healthcare system, which is already struggling with absenteeism and people getting sick and long wait times because of everything it's been through.
So we're asking people to make sure, Quebecers, to make sure that we respect the measures. That's the situation. We have to live with it now. But let's be prudent. Let's be vigilant.
In Montreal, Felisha Adam, City News.